Good day, everyone. This is Dr. Rande A2D, an education supervisor of the Commission on Higher Education in Davao Region, Philippines. I'm going to present to you our paper entitled A Systematic Review on the Relationship Between Spirituality and Physical Activity. Concern for one's health is getting more and more attention, especially during the onslaught of the COVID-19 pandemic. Though people know the importance of health, many still succumb to different illnesses. A look into the physical activity surmises as one of the effective ways or means of gaining or maintaining physical and mental health. However, physical inactivity is considered as a serious concern or problem, as it could lead to several what we call this health consequences. Moreover, it is also prevalent as an effect because of the COVID-19 pandemic, where especially when the government imposed lockdowns or restriction movements of people. But even before the pandemic, physical inactivity has been a big challenge to hurdle among many people. Several factors have been attributed to inspiring people to indulge into physical activity, such as physical activity at work, environmental factors, and concern for one's health. Moreover, spirituality comes into view as a unique influencing factor for physical activity. Spirituality is defined as individuals' search to fulfill their potential for greater meaning and life purpose in the work or in their work, or as an interaction between an individual's personal spiritual values and organizational spiritual values. Spirituality is already gaining ground in terms of influence, such as civic engagement, employee engagement, and even employee performance. Recently, scholars are focusing on how spirituality plays a role in person's health through physical activity. In this review, the focus is on the relationship between spirituality and physical activity and how these two variables affected people's lives, especially their health. On the one hand, this paper contributes to the literature on the importance of spirituality toward physical activity. On the other hand, the paper discusses the contribution of both spirituality and physical activity toward people's well-being. For the methods, first on the protocol and registration, we utilize the PRISMA model using the following databases: Google Scholar, Taylor and Francis, Springer Link, ProQuest, and Science Direct. Before the conduct of the review, a review protocol was established, which included the terminologies in the search, databases, and the criteria for screening. And as part of the review protocol, the following were we called it the set of inclusion and exclusion criteria. So, for the inclusion, articles that the main talk about physical activity and spirituality, and articles that are written in English. Excluded, of course, are articles not published in journals or book chapters. The search terms that we use were physical activity and spirituality, spirituality and physical fitness, and spirituality and physical exercise, which are found in the databases that were already mentioned. The initial search applying the search terms in the identified databases yielded 108 articles. And later on, 7 were removed for duplication, and the final number was reduced to 8 articles. As you can see in figure 1, 100 articles were selected based on the, again, identified search terms, broken down to 24 from Google Scholar, 1 from Taylor and Francis, 7 from Springer Link, 27 from ProQuest, and 49 from Science Direct. After removing 7 duplications, 82 titles were screened and 19 were excluded. The abstracts of the remaining numbers were analyzed, leaving only 14 articles that fit to the study, while excluding, of course, 68 articles. The 11 articles were analyzed, with one being discarded, not passing the first eligibility criterion, while the other two fell under the excluded criteria. Hence, the final number of articles for review was 8. Now, let's go to the results. Based on the results of the analysis, there are 3 prevailing arguments when it comes to physical activity and spirituality. First is the influence of spirituality to physical activity. Second is the contribution of both spirituality and physical activity to a person's health. And third is acceptability of incorporating spirituality in physical activity program. So, for spirituality influences physical activity, 3 articles proved the influence of spirituality on physical activity. In a study among mountaineers in Borneo, Isfahani and others found spirituality to have a positive influence on mountaineering behavior, but physical activity also moderates this relationship. Similarly, in a study among the students of the University of Notre Dame, Australia, Waters and others found students to be more engaged in physical activity with the introduction of unconventional spiritual practices. Moreover, Selfie and others reported that, although not statistically significant, higher spirituality among Latino or Hispanic adults could increase their physical activity. Now, for spirituality and physical activity that help improve health, apart from the influence of spirituality on physical activity, both variables have unique contributions to one's health. On the one hand, Anwar and others found that both spirituality and physical activity, together with sleep duration, can help prevent hypertension. Their study was conducted among the elderly in Aceh, Indonesia, where they saw a reduction of hypertension among the respondents. On the other hand, Seljak and Stefanovic discovered the healing effect of both spirituality and physical exercise channeled through meaningful reasoning, reflection, cognition, and awareness of understanding. Another article by Konopak and Macaulay argued that greater quality of life is achieved for persons who are spiritually and physically active, although they added that these relationships are mediated by self-efficacy. Nevertheless, the aspect of people being active in their spiritual life and physicality could usher them into a good condition as defined in quality of life. Meanwhile, Moreira and others conducted a systematic review on the effects of the association of spirituality, religiosity, and physical activity on health and mental health. They found these 2 variables to promote physical and mental health. Now, let's go to the third, for acceptability of incorporating spirituality in physical activity program. Though there are studies on the relationship between spirituality and physical activity, little has been done on the acceptability of integrating the former in the physical activity program. However, one article using qualitative design reported a universal acceptance among sedentary and those obese African American women. What they also found was the participants considered it important regardless of their religious beliefs or affiliation, meaning they saw spirituality as acceptable in their quest for physical health, knowing their situation of being obese. So let's go to the discussion. Based on the reviewed articles, spirituality influences physical activity. The higher the person's spirituality, the higher the tendency to indulge in physical activity. Spirituality has a unique contribution if applied in specific situations. For example, in schools, a teacher can utilize the power of spirituality to advance physical activity or fitness program. In nursing care and hospitals, health practitioners can integrate spirituality by encouraging patients to engage in physical activities suited for their conditions, of course. And it can be noted that spirituality have been well documented in people's health. However, spirituality alone without action will not yield anything. Hence, spirituality influencing physical activity can result in positive health outcomes. And both spirituality and physical activity are presented as determinants or factors of people's physical and mental health. So in this review, it was found that both spirituality and physical activity have shown positive contribution to health. Now, if people wants to be healthy, they must engage in activities or physical activities or activities demanding physical investment while gaining inspiration and strength by deepening their spirituality. Additionally, acceptance on the integration of spirituality in physical activity program is gaining a positive response, which is a welcome development, knowing the contribution of the former in various aspects of people's lives, of course, including health. Now, to conclude, the review revealed the influencing factor of spirituality toward physical activity. Moreover, both spirituality and physical activity can lead to better well-being of the people. To better put it this way, spirituality influences physical activity, which leads to a better health outcomes. So the implication of this review suggests that to maximize personal and organizational efforts towards health, there is a need to strengthen spirituality and physical health, but the former or spirituality should be emphasized as it influences the latter. Mabuhay from the Philippines. Have a wonderful day.